Okay, thank you, Brenda, for that wonderful review, and congratulations. I think you guys are doing a wonderful job, and especially navigating through the COVID period. It's remarkable how well you have done. So thanks for sharing that story with us. The remaining of the program, we're going to shift gear and talk a little bit about a third platform for cardiac rehab, which is a virtual platform. So we want to talk about virtual cardiac rehab. My name is Srinivas Murali. I'm the chairman for the Department of Cardiovascular Medicine at Allegheny Health Network. Can you go to the next slide, please? So we are in southwestern Pennsylvania. Allegheny Health Network is a network of 9 hospitals, and the flagship hospital is Allegheny General, located in downtown Pittsburgh. And through these 9 hospitals, we have close to 1,700 beds. And in addition to that, we are actually opening an additional hospital in a northern suburb called Wexford. That should be open sometime next fall. And then we have a very large network of outpatient centers scattered throughout southwestern Pennsylvania, as well as around Erie, Pennsylvania. Next slide. We are owned by Highmark Health Insurance, which is a subsidiary of Blue Cross Blue Shield Insurance Companies of America. And as you can see, over the course of our time, we have had multiple recognitions from Joint Commission, American Heart Association, CMS, and some of those are shown here. We like to brag about this whenever we get an opportunity. Next slide. So as Brenda very nicely mentioned, cardiac rehab is an intervention that improves cardiovascular outcomes. I think the evidence supporting this is very strong, evidence-based, and this has been known for quite some time. Nevertheless, I think the adoption rate for cardiac rehabilitation, the recommendation from physicians recommending cardiac rehabilitation to the patients has not really kept up with the evidence. We know that it improves life expectancy. We know that it reduces decompensation and disease progression. It certainly improves, it allows us to modify risk factors. It has psychosocial benefit, reduces risk of depression for those patients with chronic cardiovascular disability. And it improves exercise performance and quality of life. And from an economic perspective, it clearly reduces rehospitalization rate, which is a great economic drain for health systems throughout the country. Next slide. So we have traditional cardiac rehab in our institute, our network. So we have 8 traditional cardiac rehab locations scattered throughout our geography. And as you can see, our participation rate is only 37%. Our completion rate is on average 24 sessions, and we serve approximately a little less than 2,000 patients annually. So in partnership with MoveOn Analytics, which is a virtual cardiac rehab company, and in partnership with our parent Highmark, we started a project, and we have done this before in partnering with industry and evaluating innovative ideas in healthcare. And so under that umbrella, we decided to launch this program where we wanted to see if virtual cardiac rehabilitation in our market could improve clinical outcomes, could improve economic outcomes, and could improve patient experience. Now, I must tell you that we started this program before we had heard of COVID-19. So we started last fall, and as you know, as it turned out during the COVID pandemic in our area, when all our traditional rehab facilities were shut down, we were able to enroll a number of patients into this virtual platform. And so that really clearly allowed us to have an alternative solution, which worked out quite well for us. Next slide. So just to give a very brief overview, it has the moving analytics platform for virtual cardiac rehab. It uses evidence-based guidelines and clinical protocols. Obviously, it's technology-based, uses smart technology, wearable technology, and communicates with the patient. There are clinical staff who stay in touch with the patient, and we also provide a lot of clinical training through this platform. And technical support is available for those patients who may have difficulty navigating through the technology. And it's an extremely well organized and well coordinated program. And despite the fact that we live in a market where our patients tend to be somewhat older, we have been able to see quite a bit of success with this platform, as you will hear in a few minutes. So with that, I'm going to turn the program over to Beth Kramer. Beth is the Director for Cardiac Rehabilitation Services in our network, and she will share some details about this virtual cardiac rehab program and some of the preliminary results that we can share with all of you. Thank you.
Yes, thank you. Thank you, Dr. Morelli, appreciate it. So I'd like to talk with everybody just about how we actually have implemented this into our current routine that we have with our patients who may have heart disease and are in-house at our facilities. So we start our day, we have the program coordinators who are hired through Moving Analytics that actually look for patients who are eligible for the program from a low to moderate risk perspective with the diagnoses listed here at the bottom, and also going actually into the hospital's bedside, cath labs and clinics, and getting face-to-face with these patients and offering the approach of the traditional cardiac rehab and also the moving virtual cardiac rehab. So we're offering those two programs, and then the patient selects which one they would actually like to attend and what's best for them. Next slide, please. And as Dr. Morelli mentioned, we do have clinical staff on board here that actually work through the Moving Analytics platform and program. As I mentioned, the program coordinator is the first clinical staff that actually touches or gets in contact with the patient. And they really are responsible for that eligibility, defining that, and then onboarding the patient, including working through that application, getting that downloaded on their smart device. They're providing them with some education on the blood pressure scale that's given, the blood pressure cuff, as well as the fitness activity tracker, which is usually a Fitbit or Garmin product. And then they do give once the patient's enrolled, they give a warm handoff via FaceTime from the patient to the case manager or coach that will actually be working with the patient. And this patient or this coach takes it from there. They're the captain of the ship at that point and working with that patient really one-on-one, coaching them, motivating them, and really working with that secondary prevention, mirroring the traditional cardiac rehab based on all the protocols and things we have in place for the program itself all the way through. Medical director is very much involved from the get-go, from whether there's questions with patient issues on enrollment to maybe questions that the coach has about the patient. And if something's happening, what does that medical director recommend? They're also overseeing the program overall, as well as signing off on compliance, plan of cares, and such. Next slide, please. One of the components or pieces that we've implemented working with our traditional cardiac rehabs, we feel like to collect some better outcomes on the patient, as well as look at the patient as a whole, so we can prescribe a plan appropriately and individualized for these patients, is actually having these patients attend an in-person evaluation at the closest or most convenient facility for that patient. So the program coordinator is responsible for setting that up with the brick and mortar staff to have that patient come in and do a traditional evaluation with the patient, face to face, and also participate in a limited submax treadmill test so we can actually look at their functional capacity as well as vitals and see how they tolerate exercise, so a plan can be completed on that patient. During that evaluation as well, it's a very comprehensive evaluation. They are also working through the platform, the Moving Analytics platform software, and filling out their quality of life assessments, which we have many. Next slide, please. You probably saw a picture of this in Dr. Morales' slide, and I mentioned this here, but this is the package that the patient receives, which is very comprehensive, and it's all smart related, smart technology, and Bluetooth innovative stuff that really communicates with that Moving Analytics dashboard, which is great. So the patient does have to have a smart device, which could be a computer, a tablet, or a phone. They are given by the Moving Analytics staff a fitness tracker, the blood pressure cuff, and a scale, as well as their education booklet that will be gone over with the case manager throughout the program. Next slide, please. Personalized treatment plan, of course, as we assess the patient in that initial eval, all of that information from the brick and mortar setting is downloaded into Epic, our EHR. The case manager has access to that information, and from that information, as well as communicating with the patients more in depth if they need to, they develop a personalized individual plan. And as you can see, it's very robust, very comprehensive, hitting all the risk factors that we need to take care of our patients appropriately. And as you can see, our assessment column, we're, of course, wanting to assess how they're doing in these areas before we provide an individualized plan. And we set goals, basic goals with the patients. And then, of course, being that not every patient is the same, we want to have them start out at a certain place based off of what we know about the patient, how they've done on that treadmill test, their assessments, and then work them through each of these areas. Next slide, please. And then we do give them a home exercise program based on what they have access to, whether it's a gym, whether it's equipment in their home, whether it's, we like to say walking in the mall, but that's kind of like not happening these days with COVID. So they come up with creative ways to work with the patient with what they have access to, and really promoting and motivating them to get out there, do things 3 to 5 days a week with appropriate prescribed exercise intensity and duration. And when they're using that fitness tracker, that's really, looking at that heart rate, measuring their intensity, and communicating back to that Moving Analytics application. And that information goes directly in there, and the case manager can see that. And we're also requiring them, of course, to report rate of perceived exertion, how hard are you working, any symptoms that they're having. And then, like I mentioned, everything is tracked through that activity tracker into the application itself. Next slide, please. Weekly coaching does take place. It's telecounseling, and a lot of it happens via the phone or text messaging, all working through that smart device and that application. And they're really working on all the secondary prevention touch points here: blood pressure control, nutrition, stress management, smoking cessation, tobacco cessation, weight management, medication adherence, compliance, very important. Really providing that coaching that's emotional and psychological that we know our patients need when they get into these programs, these great programs that we have. Next slide, please. And then, of course, we want to engage the provider into everything that we're doing. So from a compliance perspective as well, the cardiologist is getting monthly progress reports on their patients. And the coach is using that pretty much to work with that provider on, what do they recommend medication-wise, or maybe the patient needs to see a behavioral health counselor. Maybe they need to go to nutrition counseling and see a certified diabetic educator. All these reports that are pulled together monthly, every 30 days, are actually scanned into Epic, and they can also be faxed to the physician directly. Next slide, please. So with the remote monitoring through the software, of course, this gives you a picture about who all is involved here. The patient, is reporting everything that they're doing through the application to the coach or case manager, and they're reporting symptoms directly, their vitals, their adherence, all of that is tracked within the software. The coach themselves, of course, if the patient is reaching out and saying, hey, I'm short of breath today, I feel like my weight's up, my ankles are swollen, they're really responsible for getting back to the patient within 24 hours and escalating to the cardiologist if and when needed. And also the medical director is involved and has access to the dashboard. So they are seeing those symptoms come through as well, and reaching out to the case manager, discussing those issues, and getting the patient the care that they need whenever they need it. Next slide, please. We do have set up emergency protocols within the application. We do educate and teach the patients that we do recommend that they exercise within the emergency protocol hours here that we have set up. 8 a.m. to 6 p.m. Monday through Saturday is when the clinical staff is available to help that patient if they're having issues while they're exercising. They are advised to only exercise during those hours, and then they are instructed that if they've chosen to exercise outside of those hours, they are to contact 911 as soon as possible if they're having issues. Technical support is always available and is needed as needed throughout the application as well, if they're having trouble with their software or something's going on with their phone. Next slide, please. And here's the outcomes we have so far from the study, as Dr. Morale mentioned, that we started this last fall, pre-COVID, and we've just stayed steady with everything. We're more than halfway through the study, and I believe we're extending to the end of the year. With that being said, we've grown quite a bit with locations we're enrolling from to diagnoses. Recently we got approval to take in the chronic heart failure or stable heart failure patients. And we did do claims data, and we've seen that we've already improved our enrollment. We know this is much higher, but we do have unfortunately, a lag time on claims data with processing of about 3 months. We will not be able to see a full visual of all of our data until probably springtime after the new year, just because of all the claims having to roll out appropriately. But we've already increased our enrollment rate from 37% to 60%. And we know it's better than that. Graduation rate went from 50% to 86%. And this just goes through our engagement per member with our averages here. So obviously the patients are doing about 108 minutes of exercise per week. The vitals reported, the improvement, social support, anxiety scores have improved, depression. And we do currently have about 109 patients actively enrolled in using the platform. Average time to initiate cardiac rehab went from 49 days to 7.5 days. So as you can see with the virtual program, it's very, timely in getting those patients actively engaged ASAP. Very important. A couple of things we have learned during coronavirus, our traditional cardiac rehab programs, just like Brenda had mentioned, had to shut down. And during that time, like Dr. Morale mentioned, we were able to transfer some of our eligible patients from our brick and mortar settings out to the remote program and finish in that program. And we're finding now that these patients who were enrolling from the inpatient side or clinic side, that they have a legit fear of coming in and possibly picking up coronavirus. So we are really working hard to, if we find that patient, to get them into the virtual cardiac rehab. Some patients who have come into our sites have decided that they prefer the remote program over the brick and mortar. We've had patients come in to do their initial eval physically in person, and they say, this just isn't for me. What about that remote option? And we transfer them out. And then we've had patients who maybe aren't sure about remote cardiac rehab on the other end of things. And they say, well, hey, let's, attend maybe some of these brick and mortar sessions. If I want to stay here, I will. But if I decide, yeah, it's, maybe let's try this remote approach, and maybe I have to get back to work and then it's better for me, we offer that hybrid approach as well. So we've worked well together from a network perspective with the third party as well. And it's going very, very well. And we definitely want to look into adopting this approach or other service for our patients to provide them with another option to really take care of those barriers that we have in place for them not attending the program. Next slide, please. And I think that wraps us up. Dr. Morale, I didn't know if you wanted to add anything.
No, thank you, Beth. I think as Beth summarized, I think there is clearly a role for virtual cardiac rehabilitation. I think obviously, irrespective of the impact of COVID-19, I really think that the adoption rate for cardiac rehab continues to be a struggle. And I think engaging patients for long periods of time is often a challenge. And as we look into the future, I would like to see the virtual option either as a totally virtual option or perhaps a hybrid option that may have utility and value, so that patients can benefit from this wonderful intervention.
Absolutely. Great presentations. Thank all of you. It was very, very informative, really fascinating to see what you guys have been doing through the pandemic. We did have one question that any of you could weigh in on. Are you expanding your hours or changing your hours of operations to accommodate more patients given the need, you know, to expand space or contract space, I guess?
Well, for us, as I said, we had to expand to being 5 days a week in order to accomplish that. And we expanded our space, technically. We kind of doubled our space and increased our time by 2 additional days. But again, we are, because of the fact we don't have physicians in-house because it's a private setting, we have to stay within the normal Monday through Friday, 8 to 5 time.
One of the things I don't know if you guys can hear me, but one of the things that we did from the brick and mortar setting is we actually bought mobile floor to ceiling plexiglass, and our infection control has allowed us to put that in between equipment when we can't social distance, because as we know, expanding our space is not happening. So that has really helped us get back to pre-COVID volume and almost be there. But like Brenda said, we had to really be creative and innovative and, open up 5 days a week and really try to figure out how we were going to function with social distancing. And it's been tough, but we're getting there.
Excellent solution. That's very creative. Outcomes across both programs look really, really incredible. I was really impressed with that time to initiate with the virtual, the 7.9 days. That's really impressive. Have you, are you doing remote intake with any of those patients if they're still concerned about coming into the center?
Yeah, so we are. If they're eligible from an insurance perspective, because we're only enrolling Highmark and Highmark Medicare Advantage at this time, but if they're eligible from that insurance perspective and eligible as a client for low to moderate risk, yes, we will do that.
Great. So how optimistic are you guys that Highmark will begin to reimburse for virtual cardiac rehab? Do you think that's a good possibility?
Yeah,
yes, I think that the...
Go ahead, Beth.
No, it's good, Dr. Romali. I'm good. Go ahead.
No, I just wanted to say that I think we have had previous experience with innovative technology, which Highmark would evaluate in a similar manner, which has led to reimbursement. So I think as long as we can demonstrate that it improves clinical outcomes and it improves patient experience and the adoption rate for rehab improves as we have shown, if that number stays, I'm confident that we will get approval.
Excellent, excellent, great work. Thank you so much, Dr. Morali, Beth, Brenda. You guys have done a great job this afternoon. Thanks for helping us close out what's been a really great conference.
Thank you.
Have a great
Thank
rest
you so
of your
much.
day.
You too. Bye-bye.
Bye-bye.